I am Professor Pierre Amarenko. I'm a stroke neurologist in Paris at Paris University and also at McMaster University Population Health Research Institute. And I am the privilege to be also trustee of RQBI. So I'm the board of RQBI. And I think this is a very important foundation to promote education about lipids in general and diabetes, macro and microvascular complication of this very severe disease. 1 human in 4 will have a stroke in his lifetime. And this is true for men, for women, even more for women. And this is according to the Global Burden Disease Group in 2016. Stroke is an enormous public concern that need to be addressed by clinical trials. We don't have enough clinical trials in stroke patients. Patients with stroke and who are also diabetics are the one at the highest risk of recurrence. So it's a big concern for us practicing vascular neurology, and the risk is very high. It's around 17%. We have tools to reduce this residual risk on top of best medical therapy, including statins, including treatment of diabetes, oral and injectable treatment, and the new ones, SGLT2 inhibitors, GLP-1 receptor agonists, etc., etc. We have guidelines also to use these drugs, but we have to address this residual risk, and the way to address residual risk is addressing other complications of vascular disease, that is inflammation. And this is one of the main focus right now. And inflammation can be addressed by anti-inflammatory drugs, but also drugs that have a multipotent effect, like SPPARMα alpha activator. SPPARMα alpha activator have a strong potential to reduce the residual risk in patients with stroke, but non-atherosclerotic stroke. That is stroke associated with microvascular disease. And this microvascular disease can lead to an enormous problem, which is vascular cognitive impairment. We all have the fear to have cognitive impairment in our end of life. And this is one of the major targets for the future decades, and for the future decades for treatment of prevention of vascular disease. But to do so, we need to have right now clinical trials trying to address vascular cognitive impairment, complication of microvascular disease of diabetic patients. So SPPARMα alpha activator, we have seen that today. SPPARMα alpha activator has potential to address vascular cognitive impairment because they have multiple targets like inflammatory benefit, also targeting tau phosphorylation, targeting amyloid pathway, and targeting many other factors that are involved in this vascular cognitive impairment. So I'm very optimistic after this meeting that we have now the possibility for the first time to address vascular cognitive impairment as well as recurrent stroke in microvascular disease of the brain.